Hello. We're going to talk about the options of treatment with a patient who has a failed gastric sleeve. We talk about a failed gastric sleeve when a patient comes to our office saying that the patient had a gastric sleeve years ago. Patient had a big weight loss and then presents now with a weight regain. We also see some patients that come to our office saying they had a gastric sleeve and they didn't lose enough weight. Those are the two kinds of failure. Not enough weight loss or weight regain. The first thing to do is talk to the patient and see if they're eating a lot of sweets, sugar, ice cream or chocolate, or if they have a high intake of alcohol. But we also always have to evaluate the shape and the size of the gastric sleeve. That is done by means of a gastric upper GI endoscopy and a X-ray contrast study, a barium swallow or upper GI digestive study. Once we see those, we very often find that a patient can have a big sleeve, or they have the upper part of the stomach big because the upper part called the fundus was dilated, was left big at the beginning, or because the diameter of the sleeve is big, or the lower part of the stomach called the antrum is very big. That's the kind of thing that can happen in that scenario. The good thing about revisional surgery in a gastric in patients with a sleeve is that there are many options of treatment. It is possible to treat patients who had a gastric sleeve and didn't lose enough weight or had a weight regain with all the bariatric surgery and have very good weight loss. A gastric sleeve that is found big can be reduced or can be re-sleeved. We can make a small tube again. But we can also add a very good procedure named a duodenal switch, which is changing the connection of the small bowel once we pass the pylorus. It's called a duodenum, the first part of the small bowel. We can make a cut there, and we can shorten the way the food travels between the stomach and the large bowel. That procedure is named a duodenal switch and produces an excellent weight loss. It can be a very good rescue operation for patients who had a gastric sleeve who failed. The duodenal switch we're performing now is called a single anastomosis duodenal switch, which is a modification of the traditional duodenal switch that has shown to have a very good weight loss with less side effects than the traditional or the conventional duodenal switch. The duodenal switch is probably the best option to review a failed gastric sleeve because we're adding an additional mechanism of weight loss, which is malabsorption. Patients should be very careful taking vitamins and calcium on a permanent basis, and they should have a high intake of protein. If they do this, patients can have a great weight loss with a very good quality of life. The duodenal switch is a revisional procedure, should be performed by groups of bariatric surgery with high experience and high volume of cases. At Clinica de la Obesidad in Colombia, we perform the duodenal switch as a revisional procedure quite often, and our results are very good. The chances of complications are low, and the quality of life of the patient is very good. Thank you very much.